Hey, good evening. This is Timothy Wright. Look, you are with us again on our mental health awareness. I'm here with my cousin again, who is a mental health educator. Quintera, tell us again who you are. I know everybody know you by now, uh, but just tell us who you are again.
So, hi, I'm Quintera Wright, and I am a health educator. I've been working specifically with individuals and youth with mental health and developmental disabilities. I am originally from Greenville, Mississippi, and I currently reside in Atlanta, Georgia.
Hot Atlanta, y'all. That's where she is. That's where you are.
Mm-hmm.
Hot Atlanta.
Hot Atlanta.
So we're good. It's grateful to have you again with us. We've been getting so many reviews about this. Man, I've been getting so many phone calls just encouraging us to keep on talking about mental health because it is an issue. In fact, this is actually Mental Health Month.
Yes.
The timing is just perfect. And I've talked to a lot of people just this week, Quintera, about mental health, and it's mind blowing. Um, I want to do this. We're just grateful again. Thank you. If you're watching on Facebook, like and share. You need to share this again. We said this on last week. It could possibly save somebody's life. If you are watching on YouTube, thank you, our YouTube watchers. Thank you. Subscribe to our YouTube channels. You will get the notification every time we come up at the 6 o'clock hour with mental health. We are grateful for you. Thank God again for you. So last week, Quintera,
Mm-hmm.
we were talking about suicide.
Yes.
Um, what bothered me is the time we got off the air. Uh, um, it wasn't too long ago when we got off the air last week.
Right.
I got the inbox that someone in Greenville had committed suicide. Then, upon gathering the information, it was somebody prominent in our community. In fact, had a business for 56 years in our community. Those of you know Mansour, great business, clothing business, and suicide has nobody's name on it, but everybody's name is on it at the same time. So we want to send our condolences out to the Mansour family. You have our deepest prayer, sympathy, and we just pray Godspeed upon you. But y'all, we are dealing and facing something, and I know it's an elephant in the room, and we hate to address sometimes what we see in our room, but it is time to tackle these issues, my brothers and sisters, so we can be better. So we talked about suicide last week. Mm-hmm. So you want to kind of give us because I think, and I think you share this with us too, because stress is one of the catalysts, the mechanism that leads into suicide. So let's kind of piggyback a little bit.
Okay.
With stress. You know.
So stress is, we all have some form of stress in our life, and that's that form of tension, so some things that cause stress can be financial instability. It can be pressure from work on how you perform or how you are not performing. It can be your family environment. It could be health, so there are a lot of contributing factors to stress and how it affects us. But I think the most important thing is how we manage that stress. So we will talk about stress management and some different things that you can do that can help decrease your stress and how it affects your day to day.
Right. Now, one of the things that have been helpful to me, especially in this COVID season, is I like to write in a journal, and that's been one of my things that been helping me with stress management. But then there's a list. In fact, it's something up on our screen as we speak, and sometimes we don't really understand some of the things that we can do to release stress.
Right.
So help us out with that.
So there are some different things that you can do. I always believe in holistic approaches. Sometimes it does take, some medication to deal with some different things that may occur, like depression,
Mm-hmm.
or different things like that. But there are some different tactics that you can use. So exercise. Exercise is phenomenal. A lot of people say, hey, I don't know. I have all these different things going on in my life. I don't have time to exercise. And so 15 minutes, 10, 15 minutes a day, whether that's walking, going to the gym, there's some different yoga. You can buy a mat from Walmart, buy something from online, find a YouTube channel that you really like, and there you go. You can do yoga at home. So chatting with a friend, we always love talking to family and friends. And so I always say, find that trusted individual who's going to give you good advice, whether that's good or bad, can be constructive. And so someone you can confide in, speaking to a specialist. Sometimes, you may have to find a therapist or find someone who can give a professional opinion. And there's nothing wrong with that. Spend time with pets. I have fur babies. I think that's, up to you. Control your emotions. And so in controlling your own emotions is knowing when you are upset, knowing when you are frustrated, knowing when you are sad, and being able to tune into your own emotions. Friends can help. Sometimes you feel like when you are dealing with stress, you feel like you're alone and nobody understands what you're going through, but friends are able to help you. There are resources out there that you may not know about. Somebody knows somebody that knows somebody. And so, friends can help you with whatever it is that you may be going through. And then gardening, if you like gardening, doing different things with your hands, that's an option, or just simple other de-stress activities. So there are some different things that you can do at home, outside of your home, at work, in the moment when you are feeling stressed.
Right. And so you list at least 8 things that we can do to help us with stress management. And 2 of them I care less about. And definitely, one of them are pets. And the other one is something to do with my hands, gardening. No, thank you. But look, we have to do what we need to do to manage stress, though.
Yes.
So, Quintera, it was interesting because, we talked about suicide on last week, and there were some questions that came through your email and through the church's email as well. And I think let's do a Q&A with Quintera Wright, y'all. So, look. The first question that was asked is, what do you do when you think someone is attempting suicide?
So, anytime that you're suspecting someone you care about may be suicidal, is first being aware of the change. Sometimes you see a change in their behaviors and their attitudes that can look like from isolating, or it can look abuse to drugs or alcohol. There's so many different things that can contribute to suicide or may have suicidal tendencies, and just knowing the change, the ebb and flow up and down of what a person can go through. And so if you see someone who's jolly, they're happy all the time, and then all of a sudden they're no longer jolly or jovial, and they're not around other people, they're isolating. Instead of going out to that party or hanging out with family, they're saying, I'll just stay at home, I'm fine, I'm good. If those things cause you concern, if it's something that's been happening over an extended amount of time, just check in. Hey, are you okay? It's okay to ask, are you okay? What's going on? Talk to me. I'm coming from a place of not wanting to judge you, but I just want to know what is going on so that I can best help you. Right. So, and also if you get to a point where you see an individual who's starting self-injuries, then you definitely want to pay attention to that, because that can be harmful. I've heard people say, I'm not intentionally trying to hurt myself, I just want to get rid of the pain, even if that's something temporary, but you can make a temporary decision that will affect your life permanently. And so anytime you see someone who is in immediate danger, of course, you want to always call 911. And then, of course, your first responders will come out and do an assessment thereafter, and then they'll either hospitalize the individual, whether that's a short-term, hospitalization, or either something more long-term.
Okay. So when you say something more long-term, that's...
So there are residential treatment facilities that where individuals can go to get either crisis stabilization. Crisis stabilization is more acute, so it's like 3 to 10 days type of situation. If there's someone who's seriously maybe having some suicidal thoughts, acting out suicidal behaviors, if there's someone who is seriously a danger to themselves or someone else, sometimes there can be a longer stay.
Okay, so that's the answer. Again, the question is, what do you do when you think someone is attempting suicide? And most important, if you think they are about to, 911 is the right call. Also, you talked about the mobile crisis stabilization unit.
Yes. Just like in the state of Georgia, in the state of Mississippi, there are mobile crisis stabilization units. These are trained professionals who will actually come to you if you suspect an individual who are harming themselves or are seeing something that is concerning. Then you want to, of course, reach out to your mobile crisis stabilization unit. And it's interesting is that there's some that are really close to where we are. And so that's Cleveland, Grenada, Batesville, and Jackson. Right. So those individuals, you say, hey, there's a loved one. This is what I'm seeing. They will immediately come to you.
Right. And most of us who are in the Delta, Cleveland is probably the closest place. Mm-hmm. So, I mean, we're 30 miles from Greenville. Mm-hmm. So Cleveland, Grenada, Batesville, and even Jackson. Yes. So there's no excuse. So they will come to, and you say they will come to you to the exact spot.
Mm-hmm. They have on sites where you can go to, but mm-hmm. if in an emergency situation, you call 911, you call your mobile crisis unit, and they will come to you.
Okay. So we have, and one thing we are doing is providing resources. Mm-hmm. I mean, so there is something in Cleveland just for you. Do we need to find a number? We need to put a number up.
Yes. And so we will provide that number for you. You will see it below. Okay. And there is also a website that you can go to that will provide additional resources. There's addresses and phone numbers. These are not the only four. There are a long list of other locations throughout Mississippi. So if you're not in the Delta area, then if you're you're watching somewhere else and you're outside of, this area in Mississippi, you can call these numbers and locations and you can get help.
All right. So we're going to provide that information, that number for you. And so you can, if you're not in the Delta and, we're kind of targeting Delta, but no, we're targeting everybody. So if you're in the state of Mississippi, there are other areas. I think West Point even has mm-hmm. one.
Tupelo.
Corinth.
Yeah.
Corinth has one. Tupelo has mm-hmm. one. And I think, was it Columbus?
No, not Columbus. No, not Columbus, but definitely Corinth.
I remember sure. West Point mm-hmm. though. West Point. So there are areas for you. This mobile crisis stabilization unit. I mean, it would be a help to all of us. So again, if you are seeing somebody who you think who might be suicidal, you need to make every attempt to reach out to that person, so we won't see another suicide, especially in our Black community. Do that for us. Here's the other question, and I thought this was kind of broad in a sense too. Mm-hmm. How do you find a new therapist?
Searching for a new therapist can be difficult. It can be challenging. You've already found someone, if you're already seeing a therapist, found someone who you really like or don't, and you've already exposed yourself to them. You've became vulnerable with expressing past trauma or even present trauma that you may be experiencing. And so having to relive those situations with someone new is always challenging. Especially if you had someone who's really awesome, they created a level of expectation of what you're looking for every individual that you have as a therapist. And so that in itself can be hard. But if you're someone who have never had a therapist before, I definitely encourage you to reach out. If you do have insurance, reach out to your insurance carrier. There's always a 1-800 number that can provide you a list of therapists that's within your area. Because of COVID, this is a good thing though, because of COVID, a lot of therapists are doing telehealth.
Okay.
So
Okay.
even if you find a therapist that's outside of the Delta, you can always, if they're in the state of Mississippi, find a therapist maybe that's outside of the area, and so that's a good thing. And so telehealth, I feel like it's virtual calls, so and for some people it's a little less intimidating versus having to sit there in someone's face and stuff like that. So it's like maybe talking to someone on Facebook and or talking to someone on FaceTime. And so it's I think it's a really cool option to have. And but when it comes to finding a therapist, I think that you should explore your options, because there are all kind of therapy that you can do. So a lot of people, they think about therapy and they only think of talk therapy.
Right.
There's equine therapy, there's art therapy, there's music therapy, there's cognitive behavioral therapy. So it just really depends on what's beneficial for you. And then knowing, hey, like talk therapy isn't my thing, but I love music. Like let's kind of dive over here, or I love art, let's dive over there. So explore your options. Anytime you are looking for a therapist, research a couple of different therapists. Don't just go with the first person you see and then it's okay, they took my insurance, or I'm going to pay out of pocket and then we're good. Explore maybe 5 or 6 different therapists and vet them out. Talk to them, tell them what your expectation is, what you're looking for. Can they do follow-ups? So really know what your expectation is for looking for a therapist. And it's okay to fire a therapist, right?
Okay. Okay.
If you have to let go of a therapist, it's okay. Just be prepared to try to find another one. You don't want to go with gaps of times if you felt like therapy was beneficial for you.
Okay. Now, I thought this was interesting because therapist does one thing, but then there are some people who therapists might have to recommend something else. Because this I didn't know, but I did know in a sense too. Therapists cannot prescribe medicine.
Right.
So that they would probably prefer you to a psychiatrist, right? All right. So they prescribe medicine, and that there are some times where therapy might not be working, and we may have to do something different. Okay. So I think that was important, and we were talking about that some time ago as well.
Right.
So here's the reality, y'all. Whatever works for you, you need to do it. So we're here again for you. We're going to pause again, Quintera, for station identification. You are here with us again, Mental Health Awareness. I'm Timothy Wright, along with my cousin, who is a mental health educator, Quintera Wright. Again, if you're watching us on Facebook, thank you. Like and share. If you're on YouTube, watching us from YouTube, subscribe, get the notification when we come on air. So we were dealing with suicide on last week.
Right.
And again, we're seeing it so much in our Black community. But then I want to focus tonight on let's do this question, because there's another question, because my wife is a nurse practitioner.
Right.
And the question was asked, can a nurse practitioner prescribe medication? And when they was talking, I'm assuming when they was talking about medication, they was talking about medication for mental health. Yeah.
Yes, a nurse practitioner can prescribe medication. They are licensed to do so. And so I think it's very important that you are as open as possible when you do have a physician or a nurse practitioner, and telling them about how you're feeling, how it's affecting your emotional health, how it's affecting your physical health, and your work-life balance. Because then they can best prescribe the right medication. So like I said before, medication can be tricky, because you may not find the right medication that works for you the first time.
Right.
You may have to have different medications over a period of time, and then you're like, okay, this is the one. And then when it comes to medication, you have those individuals, like we said before, who gets on medication and then they're feeling great for a while. and then they're off of their medication. So there's an ebb and flow of up and down when it comes to medication. But you also can always see a nurse practitioner, and you can see a psychiatrist who can also follow like your case plan, develop objectives and goals for you to accomplish.
Okay. Okay. So there you have it. So we need to talk about this because, again, we look at the fact that the ages of 14 to 24, we see suicide rate has increased.
Mm-hmm.
And I was thinking about the fact that there's, my daughter's getting ready to go to college. My
Right.
son is in college, and they're about to have the freedom of their life.
Right.
Whereas it's up to them if they go to class or not. So that means the instructors don't see them as much
Right.
as they would see them in high school.
Right.
So we want to target that high school area, at least from 14 to 18, and
Okay.
let's be honest with ourselves, even some less than that, because I've experienced a situation where there's sometimes the child has to reverse role with the parent,
Mm-hmm.
and we don't understand the trauma that sets up in that child trying to be an adult
Mm-hmm.
when they have not even been a child.
Right.
So that's some of the things. So
Right.
we want to look at that because in the state of Mississippi, and I think you want to talk about this because there's a history of suicide prevention in Mississippi.
Yes. In 2009, there was a legislature passed for preventative health,
Okay.
and it was focusing on suicide and self-harm. There has been an increased number up until 2009
Okay.
of suicidal rates for children, specifically in that age group.
Right.
And so in just 2020, there was 441 teen deaths that were school-age children throughout the state of Mississippi.
Wow.
So that number is pretty high, but is not as high as it once was. And so the goal is to continue to decrease that number all across the states, but specifically in the state of Mississippi, this law was passed. And so with the preventative work, it is to train teachers and also principals on suicide and prevent on different ways to save a child's life.
Okay.
And so there was 4 different curriculums that has been adopted throughout the state of Mississippi. Any county can decide on what, or the district can decide on what curriculum they want to use. And so they're not obligated or have to use all 4. They can choose one, and then that's fine. And so there is a nurse, or the district a superintendent can assign a coordinator person to be the point of contact for those trainings, or for the staff, whether that's teachers, those are school bus drivers, those are your nurses, the social workers, whoever are involved with the child are by law obligated to have this preventative training.
So, and I think you were sharing this with me as well, that teacher or whoever is in that district has to get that training.
Mm-hmm.
And then they become mandated reporters.
Yes. So, like myself, I'm a mandated reporter, but mandated reporting came back in 2006, actually.
Okay.
And it was a federal law that came about, so it covers all 50 states, and that is an individual who is in the profession of working with children are to report any suspicion of abuse, neglect, or even self-injury behaviors. And so they report those different facts or different things that they are seeing to their child protective agency, or even that school, and provide that information of, hey, I have a student. I've been with this student for the past 90 days. They're coming to school with dirty clothes, or they're hungry, or even medical neglect. And so you can report those things, and by law, we are obligated to the state is obligated to follow up on whatever is being reported.
Okay. So in 2017, the legislator in the state of Mississippi passed House Bill, I think it was 263, and Mississippi Department of Education shall require all districts to adopt a policy on student suicide prevention. And you kind of mentioned that, but then it requires all school district employees to be trained in suicide, suicide prevention. That's a curriculum, and that was in the year of 2017-2018 school year. Now, I talked to a good friend of mine, William Murphy, and William Murphy works in the Sunflower Consolidated School District, and I kind of asked some questions about it because I was trying to figure out how did it work, and thank you so much, William Murphy, a good friend of mine. Actually, they honestly only have to train one time, but every time a new employee comes in to that district, they have to be trained. But they implement it where they get training every year, and I thought that hats off to Miss Davis. She's the superintendent of the Sunflower Consolidated School to put things like this in play for our children. Our children are more than just our future. Our children are right now. Department of Mental Health responsive for selecting the curriculum, but then the school pick their own curriculum, and you mentioned that already. But then I'm just excited about the fact that everybody is involved in this, because every person that works for that district has to go through that training. If it's the bus driver, the cafeteria staff, the custodians, the nurse, the teachers, and any administrator has to go through this training. They go, and they're doing it on their own time. And once they're finished the course, they print out the certificate to know they've been through the training. So I thought that was exceptionally well. Thanks again, Sunflower Consolidated School. You're doing a wonderful job. Thank you for putting that in place. Thank you, William Murphy, for not the singer, William Murphy, my friend. Thank you for giving us that information. So the question now, children with suicidal behavior, again, we talked about the teachers are mandated reporters. And once they report, how does that work?
So anytime a report is being made, especially when it comes to suicidal behaviors, it seeks immediate attention. And so normally in a case of abuse, neglect, or anything like that, CPS is supposed to respond within 24 hours.
Okay.
But when a child is having self-injury behaviors, then of course your first responders are going to come immediately.
Okay.
They'll come to the child. They'll come to the school. They'll assess the needs of the child, and then thereafter, if someone say, "Hey, I was just playing. I'm not doing anything," you know what I mean? They will assess, is it serious or not? You know, anytime a child is like I say, is doing any form of self-harm, it's a cry for help. You know, it's the cry before the major event. And so you want to take anything serious that's like that. And so, but you have your first responders who will come out. Sometimes they'll transport the individual to a hospital.
Okay.
And then once they're in the hospital, and then of course you have social workers, you have nurses, you have your physicians who would then talk to the youth and their parents.
Okay.
And so then they will have a case plan, or of course an action of the next steps that they will take place. For some individuals who are most of the time, any individual who is being hospitalized for an incident such as this, they will do a bed hold. Okay. And so they'll hold you for 3 days for evaluation. And if they deem that they need to keep you any longer, then they will do a 1013, just saying that they're going to keep you for an extended stay.
Okay. Now, the question is this, because a lot of times we as parents are naive about our children sometimes, and we have to be honest with ourselves. I thought about this because in the span of 9 months, most of their time is spent in school, where the teacher is somewhat know more about the child than some of the parents do.
Yes.
You know, so
yes.
what part does the parent play in that? Because sometimes the parent don't want to get their child involved in the fact that, yeah, my child might have cried out, but they're not suicidal. But then at the same time, we got to put in like when they put that act out like that, we have to respond to that, because we don't know what they might do.
Right.
So what if a parent don't want that service?
Right. So oftentimes I hear, oh, they just want attention, or hey, they didn't want to do their homework, so this is how they reacted, and so it's downplayed a lot of the times. Like, you do hear parents often say, like, not my child would never do that, and sometimes it's not the case,
Right.
Right.
And we've seen that.
Yeah.
Absolutely.
And so children go through a lot of different things, and a lot of times parents don't know that children go through these different things, whether that is bullying or having a hard time understanding the classwork, or feeling not heard or not valued. And so there's so many things, contributing factors, that can cause a child to have suicidal thoughts and feelings. It's the feeling of, I don't have control of the situation, and this is an escape, whether that's long term or short term. Right. And so, like you said before, teachers do spend a large amount of time with the children, with the students. And so I often say, sometimes teachers know that child better than sometimes the parent know their child. And so when you think about it, a child is in school for a very long period of time. They spend a lot of their waking time in school. And so you think about a child getting ready to go to school. School starts, just thinking about for Georgia, for instance, elementary school, middle school, usually typically starts around 6:30 and 7 o'clock.
Right.
And so they're in school from 7 sometimes to 2, 3, and 4.
Absolutely.
And so that's a long period of time. And so when you got children who are involved in extracurricular activities, and so they're in school even longer. And so they go home to eat, do homework, and go to sleep. So even when they're at home, they spend a large number of time asleep. So a lot of times parents have that small window to get to know their child a little bit better.
Right. And the it was a question that was asked too, because a lot of times parents don't want to be involved in the fact that their child might be suicidal. Again, we can be naive about the whole situation, but then for the teacher who go through that course, gets a certificate, and then not report the fact that they see perhaps suicidal behavior in the child that comes to their class on a daily basis, what can happen if it's not reported, and that child actually end up committing suicide, or that person say, then the teacher say, well, I kind of figured that something was wrong, but you didn't report it. But then you are, again, what? A mandated reporter. And it is your responsibility to report a strange behavior of the child. When that pattern changes, we need to, that's something we need to do about it, because again, that child is calling for attention. But what happens if the teacher or somebody in the district don't report that?
So it can be tricky.
Right.
As a mandated reporter, you are by law obligated, by every means to report any suspicion of self-injury behaviors. In situations where a person decides they knowingly or they know and have the intention to not disperse that information, it can sometimes fall back on that individual. And so it's a liability at that point. I knew that this child was hurting themselves. I knew that this child was smoking and taking pills or doing chemicals in the restroom. And I decided to not report, and so if something happens and there's an investigation taking place, then sometimes by law, I've seen situations where teachers get subpoenaed to go to court. I've seen situations where, a mandated reporter is charges are being filed against them because of negligence. You could have saved that child's life, but yet you decide to not report it because I'm too busy, right? Or I don't have time right now. I got 30 other students that are like in my classroom and they're acting out and all these different things. And so sometimes there are different factors, but because you made that decision not to, you decided to not prevent that child from seeing another day.
Right, right. And it's, I mean, again, this is so much we could talk about with this. And again, mental health awareness has been one of those things that's been dear to me. And just the fact that our kids are suffering, and sometimes we don't know what they're going through, and at most we're trying to be the best parents we can be. Do we need to talk about postvention?
Yes. Even just going back into the school situation, there are resources within the school.
Okay.
You know, every school is assigned a psychiatrist. You know, every school has a psychologist. You know, every school has a on-call social worker.
Okay.
And so students have the ability, you know, once these things have been reported, to seek out help from these individuals.
Right.
And so I do encourage every child, even if they're teenagers or children that are listening to this, every child to go talk to your teacher. Go talk to your counselors, because those are the people who can advocate for you, who can help you in your situation. Even the parentified child who said, hey, I have reversed roles with my parent. I'm tired. I'm exhausted. I've been going through all these different things. You know, they can go to those people who can advocate and help them get out of those situations.
Right.
Yeah. And so postvention work, we always say, you know, postvention work is really happens after suicide has occurred.
Right.
You know, and
so
so
and let me say this before you do that. And this is the point we're trying not to get at. But let's be honest with ourselves. We've seen it, and it often occurs. Especially again, we're seeing it more in our Black communities.
Yeah.
So we need to really talk about postvention, and because sometimes this is what happens, and this is where we're not trying to get to. Okay.
You know, suicide is a scary word.
Right.
You know, no one likes to have that conversation. No one feels comfortable having those type of conversations. But like you said, it happens, and you know, the school is aware. Federally, you know, federal laws are put in place because they are aware that this happens regularly.
Right.
You know, and so the postvention work is put into play. And so it always start off with you want to reduce risk as much as possible. You want to promote healing, so reaching out to people who can advocate for you, who can give you those resources. You know, I've seen private agencies or companies come into the school, work with children individually.
Okay. You answered my question, because my question was going to be, what happens when a district experiences suicide, and I'm sure people come in and to do any type of counseling, and sometimes we might have to assess the children, and that could have been a friend. So that's stuff like that is in play where they come in. Okay.
Usually, anytime there has been a death, there's always a psychiatrist there that you can talk to, a psychologist, to really work with those individuals, and they're pretty much 24-hour staff.
Okay. Okay.
Because even after you go home, they want to be available for that child, that family, to help process their thoughts and their feelings and different things like that.
Right.
To prevent another child, because grief, like we talked,
Absolutely.
you know, grief
Absolutely.
affects you, and so to give that support as much as possible. And usually they're there for the duration of the school year.
Okay.
And sometimes even longer, so summertime and the following year. And so there are dollars set aside for that.
Okay.
You know, you want to verify the death, don't label it, right? A lot of times you say, oh, this was you know, this was a suicidal death. You know what I mean? And so a lot of times legally, you don't necessarily want to put suicide death out there. You can say, hey, maybe the death is unknown at this time.
Right.
Because you don't know the sensory behind that and how that affects other people.
Absolutely.
Assess the situation. So meet to prepare postvention work. So a lot of times school districts get together amongst the teachers, they get together amongst the district and talk about what type of implementation we can put in place, what type of protocol we can put in place to help support the students and the teachers.
Okay, so good. I'm glad you mentioned that, because we are talking about the children, but then a lot of times teachers really develop relationship with some of the children, and it'd be like, this is my own child. So that there's something in place also for the staff,
right?
Okay.
Because everybody, whether you believe it or not, everyone touches that child's life when they enter that school.
Absolutely.
Whether that's the custodial worker, whether that's the lunch lady, you know what I mean? Everyone plays a part, and even, they have relationships outside of just the classroom,
right.
And so the gym teacher, the coaches, you think about that. And so there's support for the entire school.
Right.
You want to share information with staff, students, include only basic information.
Okay.
You don't want to, a lot of times they say, hey, we don't want to put the information out there, but they're going to find out anyway. We're in the world of social media.
Absolutely.
Everybody's going to find out everything at one point or another. Most of the time school gets ahead of the game, put the information out there, maybe have all staff or all the students come to the auditorium and talk about, hey, this is a death, this is a loved one, we want to do a memorial, however it is that they want to do, to show their love and their condolence. Avoid suicide contagion. So consider possibilities of other high-risk students, so students that you feel like will be more susceptible to self-injury behaviors or suicide. You want to identify those individuals, and so the district will put together a list of students who were maybe close friends, or maybe they interacted in the same extracurricular activities, or however, because you want to help those children as much as possible. Right. Memorial plans, all deaths should be treated the same way, and so we just feel that no favoritism should be put involved. Okay. So say that there was a death of multiple students, and the school went out for maybe the football player, but they didn't do anything for the girl who was in the choir. Gotcha. You know what I mean? So you want to treat everyone the same. You want to give the same love, the same condolence, the same sympathy to everyone. And then external communication, usually that's done through PR work, right? Okay. So you may have, the school district may have, someone who puts some information out there to, the news outlets, or to, your newspapers and their Facebook, social media platform. They'll put like a statement out there, a formal statement. It will be put in place.
Right. So this has been good. I think we probably need to stop here.
Okay.
We'll stop here, and maybe pick this back up next week, or talk about something else next week. But we're going to be talking about something with mental health.
Okay.
Thank you again, Quintera, for helping us out, and we just hope that this information has been vital to you, where if your child is experiencing such things as having suicidal behavior, you can get help. So again, there's information available to you. I think that's a website we, is it mentalhealthms.com?
Yes, I believe it is. And it's the same website that we had below earlier. We'll provide it again. It has the crisis stabilization information. There are locations, there are phone numbers where you can reach someone, even if you need to have a conversation. Hey, talk me through what I need to do.
Right. And then also United Way, again, 211.
211.
You can dial 211, and they'll prompt you to where you need to go, where you can get any provider that's located in your area, and you can do that as well. So again, y'all, there's so much information available to you and for you. It is for your good. It's and that we won't have to be in a situation that we have to do postvention, and that's where we're trying not to get. So again, thank you, Quintera. Any final words?
No, this is important work, and you'll be amazed how you have the opportunity to save someone's life or be an influence in their life in some way or another. Have these conversations. Sometimes they can be a little bit uncomfortable, but it's important to have these conversations, because you can go to bed the next day and say, dang, I should have said something.
Right. Hey, y'all, thank you again for watching I'm Timothy Wright.
I am Quintera Wright.
Hey, we'll see you next week.
Thank you.